Good morning and a very warm welcome to Bonitas House Call here on SABC 2. Ntoza ukuthi sibamba ngazimbini wendawo nendawo kumakhaya namakhaya apho nibukele nokuphulaphula nikhona. I'm Dr Victor Ramathesele. Nganolubisitsa ngaka katlulu. Letla ngwana sa tsotang se sengwe se seng hora haile ya borobong se. Now laser technology has revolutionized many aspects of our lives. And it is therefore not surprising that healthcare has not escaped its influence. Today we focus on the critical areas of the industry that have been impacted and improved by this innovation, ranging from diagnosis, treatment, surgery of many medical conditions. You might find some of these innovations a little bit too good to be true, but as they say, if something is too good to be true, it is too good to be true. Now let's together watch this insight on laser hair removal and hope that they do tell us a little bit about these things that are too good to be true. Let's watch.
I'm Sue-Ann, a therapist at Skin and Body Renewal in Brooklyn. Today I'm going to show you a laser hair removal treatment done with the Cutera machine on my client Comfort. Okay, first we're going to start to clean the area. The reason for that is to get all the deodorant off that could have a reaction with the laser machine. Make sure that the hair is short enough. The hair must just be out of the skin. The reason for that is when we do the laser, we want the laser's energy to go into the hair follicle and not into the hair itself. So when the hair is too long, it absorbs all the energy, falls flat on the skin and then only burns. So there won't be any reaction in the hair follicle where the treatment is active itself. The second step will be then icing the area. The reason why we ice the area is to numb the area, as the laser is quite painful. Step in the procedure is then to put the sonar gel on. That's to conduct the energy onto the skin. We set the joules according to the client's skin. So not every client is treated the same. It depends on the color of the hair and the pigment of the skin. Then we give protective gear to the client, just as a preventative measure, and then you can look to the other side for me, please. Are you comfortable like that?
Oh, yes.
So this is the actual laser procedure, where the energy of the laser goes into the hair follicle. The bits of smoke that you see over there is actually hair that's exploding in the hair follicle, and that's what we want to see. There we go. So that was it for the laser hair removal. As you can see, a really short treatment and not as painful as people think it is.
Nazo. Now we invite you to join our discussion on laser technology in healthcare by calling us on 083-913-4687, or you can send your SMSs to Bonitas at 33723. We have also invited special guests into the studio who are experts in this field. And they are going to help us unpack the subject. Now welcome Dr Maureen, who is an international advisory member and vice president of OSSA, the Ophthalmological Society of South Africa. We are also joined by Dr Maureen Allem, who is the owner and aesthetic practitioner of Skin and Body Renewal here all over the country, I'm told. Thank you very much, ladies and gentlemen, for joining Bonitas House Call this morning. We're supposed to be joined by Professor Modise Koto, who unfortunately could not make it into the studio because of an emergency that cropped up. But we will hook up with him a little bit later on the show telephonically, because we also want to cover some of the surgical aspects of the uses of laser technology in healthcare. Now, quickly, Dr. Lohodi.
Go ahead.
When I look at this thing, it looks like it's a cutting torch. I mean, instead of using a scalpel to cut, you guys decide in certain instances that you'll use something of a cutting torch. Would I be making it too simplistic to suggest this?
Yes, you know, the things about the laser these days, it has its own advantages, because now we are looking into the laser, whereby the laser is just we're using to cut with it, treat with it. And in terms of cutting, you can see that we are no longer using any scalpel, which is good. And no scalpel means less scarring, which is excellent for...
Before you talk about the advantages, as a doctor, obviously, you'll speak about the advantages before you speak about the disadvantages. But of course, we want to have a balanced view of this. But let us see if... Professor Koto. Professor Koto, do you have him on the line?
Hello?
Professor Koto.
Yes, hello, Dr.
Thank you very much for joining Bonitas House Call. What a pity that you could not make it into the studio. But we'll do the best and see how far we can go with this discussion. Now, if you are going to describe laser technology to Nkhonwaka Rakhadi Khanthe in Heilbron, who has not been to any of these fancy things that we are talking about today, how would you describe it?
Essentially, it's the conversion of electric current into a beam of light, of intense light with different intensity, basically, that allows us to perform a variety of procedures, as Dr. Lahode has indicated, ranging from excision to ablation. So essentially, basically, the technology that converts electricity into this beam of light that can be used for a variety of purposes.
Okay, in your field now, and I know you've made a name for yourself in having been very innovative. Where are you using laser most in your practice in this day and age?
We use it in a number of fields. We use it in the gastrointestinal tract for excision of polyps, for example, for excision of a number of lesions. We use it in settings where, for example, there's abnormal blood vessels in the gastrointestinal tract to ablate blood vessels. We also use it in open surgery, for example, in major liver resections. We use it. So it has really a very wide range of applications in surgery, ranging from cosmetic surgery to really therapeutic surgery.
Now, we had Dr. Sfiso Mthembu a few months ago. We were discussing appendicitis with him, and he did indicate that you've also done a lot of work around management of appendicitis using laser therapy. Do you want to tell us a little bit more about that?
Yes, the laparoscopic appendicitis is something that has really become now what I would call the standard of care in this day and age. We would use it certainly to control bleeding, for example. There's a number of ways of controlling that, but laser is just one of the many ways where when we recise the appendix laparoscopically, instead of tying with a suture like we do with open surgery, would use laser, for example, to ablate blood vessels. So it has got a number of applications. We would also use it, for example, laparoscopic cholecystectomy, where we remove the gallbladder from the bed of the liver. It's got an advantage that it excises with minimal bleeding, without causing surrounding structural damage.
It sounds exciting, and Dr. Lahode has already indicated that it avoids a whole host of other complications associated with using conventional methods of dealing with these issues, especially in surgery. But what would you say are the major disadvantages of laser technology in surgery?
Always like everything else, there are some disadvantages, and one of the disadvantages is that sometimes it causes unintended damage to the surrounding structures, particularly when you are using it in structure that have got thin walls, for example, like in colon, where we use it for ablation of abnormal blood vessels in the mucosa. So there you have the risk, for example, of perforation, dissipation of energy to surrounding structure, and damage of structures that are close to where one works.
Now, in conclusion, it does sound like it's not the type of thing that any surgeon can do. Would you say at this point it is still highly specialized? Only a few surgeons, at least in this country, can practice this?
I think it's something certainly that one has got to be facile with to be able to use it properly. But in terms of training individual to using it, it's not something formidable. I think everybody can be trained, and many people can be trained in a very short space of time to use it safely and to use it wisely on patients.
Professor Modisa Koto, Minister Aaron Mutwari has already indicated that we only produce about 1,200 medical doctors in this country per year, and we need to bump up that number to at least 3,600 within the next 5 years. And I'm very excited that you have taken the challenge and you have joined the academic environment to ensure that we can produce more and more quality doctors in this country. Good luck in your chosen profession, and we'll continue to liaise with you and to get and extract all that knowledge that resides in you and our colleagues in the University of Limpopo. Thank you very much for joining Bonitas House Call. Good morning. And good luck in that emergency that kept you away from the studio today. All the best.
Thanks very much, Dr. Ramathesele.
Thank you.
Thanks very much. Thank
you. Very interesting stuff, eh? Now, you would have thought, Dr. Allem, that laser therapy, because that's how it has been marketed. We read about it in women's magazines, in beauty magazines, and everywhere else, and you watch a lot of these Hollywood television stations. It's always almost portrayed like it is a special preserve for people who want to make themselves look beautiful. Now, in a general sense, and we've seen the instance that talks about hair removal, what in cosmetic medicine or aesthetic medicine, which is where you are, what are the major areas where laser therapy can be used?
Look, the biggest condition is excess hair on the body. You know, very often women have hormonal hair, and then they come once a month to actually remove this hair. And then I'd say hair removal is the biggest one, and fortunately our laser can also do a dark skin, black skin. So at a completely different setting, you can do different skin types. So the beauty about the ND-YAG laser, the long pulsed ND-YAG laser, is that all skin types can be treated. So obviously when we do a darker skin, we have to drop the energy, the fluence of the laser, and we have to widen the pulse width so we don't burn the patient. But as you can see, we always have epidermal cooling. That we first cool with an ice pack, and then that gold tip is cooled. So as the laser is pulled along the skin, it protects the epidermis, and then it works deep in the dermis where the bulb of the hair follicle is, and that's how we have hair removal.
But women who have hair on their face and they want it removed, why can't they shave? I mean, what are the advantages of using laser instead of just shaving their hair?
It's just that shaving, you know, the hair becomes quite thick, and you know, it's very rough to the touch. And women aren't used to having, you know, rough skin on their face. So you know, when you shave like a man's skin, once it's shaved, I mean, it doesn't take long, and then that hair comes out. You know, like the 5 o'clock shadow. So that's the disadvantage of shaving. You actually have that rough feel to the skin.
Does it grow back once you've removed it with laser?
Look, you have to, unfortunately, not the first treatment. You have to have quite a few treatments for laser hair removal, because the laser only destroys the follicle when it's in the growing phase. Okay, it doesn't, because there are 3 phases of hair growth. There's an anagen when the hair is growing, then there's a telogen when the hair is resting, and then the anagen when the hair is falling out. And very often women get quite disturbed when the hair starts falling out, but that's only that only means that lots of hair follicles are in that stage where it's falling out. So when we do the laser hair removal, we can only destroy the follicle in the anagen phase.
Okay, let's hold it there. Let's hold it there. Sounds quite interesting. When you're looking at it from far, you might think, but some people are really concerned about this, and they go to great lengths to remove this hair, and they are prepared to stand the pain and pay a bit of pop to do this. One is and continue our discussion on the laser technology in healthcare. You stay with us.